One of the things I learned really early on in my career is that patients need to be heard. And so giving them a chance to tell their story, talk about what's wrong with them, gives you the chance to really understand what is wrong with them, put together a full picture, and realizing you might not figure everything out on day one, but over time that you'll be able to help improve their quality of life overall. Hi, I'm Dr. Joshua Wechsler. I'm the medical director of the Eosinophilic Gastrointestinal Disorders program here at Lurie Children's. I consider myself to be a pediatric gastroenterologist. So my formal training is in the study of the gastrointestinal tract, but more specifically, I consider myself what's called an esophagologist. So my absolute focus is on the esophagus. And then I consider myself to be an interventional endoscopist. So I'm somebody that can deeply interrogate the function of the esophagus, understand whether that function is compromised, and intervene to help improve that function. At Lurie Children's, we have a top-tier eosinophilic gastrointestinal disorders program. And as the medical director, I both see patients and coordinate the direction of the clinic, including working with all of the personnel in the clinic to review all of the patients, to ensure the flow of the clinic is managed as effectively as possible, to integrate with the procedure process, to integrate with research. We approach our patients with the idea that you're going to be managed by a medical team. What you really do want is for your doctors to communicate with each other. You want them to talk so that where one doctor understands one aspect of a process and another doctor understands another aspect of a process, that you can come together and synergize. And I have had incredible success at treating some of the most complicated patients simply by sitting down and working with other doctors in dermatology, in hematology, and rheumatology. There is no question that we have incredible people at Lurie Children's. People that care about each other. They want to work in an environment where everyone feels safe and supported. People are friendly, they want to be collaborative, but they also care deeply about their patients and they put the patient first. And so making sure that the patient is the center of the conversation of what we're doing here, what's our goals, what we're trying to make better. I think that is really what defines the people that work at Lurie.